someone may come to the ER because they had an upper respiratory infection and they were given an antibiotic and they just don't feel better. And what they don't realize is, well, it's probably viral and it's got to run its course, and the antibiotics have no effect on that. So you try to tell them, well, there's no use giving them another antibiotic because that one's not going to work. And the problem is that can cause. So let's just run it course. I can treat your symptoms. Some people accept that very readily, and some people don't because their doctor said they needed an antibiotic. So it can be a varied conversation. Sometimes it's more difficult, sometimes it's easier.
And a common scenario is maybe like a UTI, and they've had them in the past and there's similar symptoms and they're convinced all they need is some amoxicillin clavulanic acid. And you're trying to show them the UA and the initial culture is like, you don't need it. It's more inflammatory mediated, maybe something else. Those are the tough conversations because they're already convinced based on previous experience that was true. They're extrapolating it to the current, and they have to understand that you got to start over.
The biggest challenge I think we have a lot is with viral disease, and people, come in with the sneezing cat and they want us to prescribe an antibiotic, and, there's may not be indication for that. So we have to kind of get through that. And I usually tell them, look, I don't think we need it, and we'll save you money by not having to have you kill this cat. And this is what we're going to advise that you do. So, a lot of times we get around it, and then because we always ask that they come back within 2 weeks of the problem, whether it's a GI issue or a sneezing cat or a dermatologic issue. And I'll tell them, if you're not a whole lot better in 2 weeks, we'll rethink that. We'll see.
Having those conversations, those difficult conversations, is hard. I've had certain circumstances where I get a lot of pushback from the parent of, we're not going to come back. We're not going to do this. This kid has something wrong with them and I need you to treat it. But in those situations, it's really about spending more time. So it goes back to that, sitting down and saying, hey, listen, I don't want your kid to have an unnecessary antibiotic that could cause additional side effects.
We get a lot of folks call in asking if they can just get another round of antibiotics because it worked once before for a similar problem, which, might have been last week, but sometimes it was like a year or two ago. We can't tell just over the phone if it really is the same problem or different. Sometimes it seems like a quick fix, but educating them that doing antibiotics over and over again is not ideal if we can figure out, why the infections are happening in the first place.
Quite frankly, just medicine is not free. There may be the worry, wow, now I have to pay a second copay if I do have to come back. So I really want to avoid that. Another challenge that we have in holding off on treating, even when it's inappropriate, is to some extent, I'm going to say we have a societal precedent of, I want results now, I want a cure now. And it's difficult to understand that so many of the aspects of the healing process is really the time to heal.